this is a bit of a last-minute session that we were able to add on the ACOG Toolkit for providers for bereavement care. And so I'm thrilled to introduce, I hope you guys are there, Dr. Michael Belmonte. He is a complex family planning subspecialist and assistant professor of obstetrics and gynecology at Penn State. Michael's worked with the World Health Organization and as the Darney Landy Fellow at the American College of Obstetricians and Gynecologists as the national spokesperson for family planning. And he's also the obstetric lead for Penn State's new pregnancy after loss clinic. Yay. Sheila Reynoso of ACOG was going to be with us, but she's not feeling well, and so we wish her well. And then we also have Dr. Karen Gibbons on the line. Karen is an MFM at Oregon Health Sciences University and formerly at the University of Utah. Her research focus is adverse pregnancy outcomes due to abnormal placental development, including fetal growth restriction, preeclampsia, and stillbirth. And Karen is also the mother of her stillborn son, Sebastian. So we're really, really grateful to have Michael on, and I'm going to hand it over to you, Michael. I hope that...
The audio's off. So you'll get our audio.
Can you...
His audio is off.
Oh, Michael, your audio's off. We can see that it's off. There you go.
I can hear you now as well.
Perfect.
He doesn't know that you just did the intro.
Oh, Michael, sorry, I just introed you and it's yours.
Excellent.
Sorry.
Hello, everyone, and happy Friday. We're so thrilled to have a bit of time to introduce the ACOG Toolkit for Stillbirth Bereavement Care. It's entitled Supporting Patients Through Stillbirth Care, a Toolkit for Healthcare Professionals. Sheila Reynoso from ACOG was supposed to give the bulk of this talk. Unfortunately, she is ill and won't be able to be here today. But certainly if you have any questions or input, we're going to try and answer those questions at the end. And certainly if you have anything to share with ACOG, we'll include her contact information at the end of the presentation. So with that, we will jump right in. And so, just a bit of background. In 2023, ACOG received a grant from the Centers for Disease Control and Prevention to improve health outcomes for pregnant and postpartum people. One component of that project was to evaluate implementation considerations, particularly for the management of stillbirth, which was the theme of focus groups that occurred, two of which were held at ACOG's annual clinical and scientific meeting. ACOG and CDC are particularly interested in finding out more about OBGYN's awareness of and use of the management of stillbirth guidance, how it's being implemented, and really to identify specific parts of that guidance that would be most valuable, as well as any additional supplemental resources that may be desired. And so the goal is to take what we have learned from these focus groups to really inform future ACOG resource development. These focus groups were 1 hour and they were convened to discuss participants' awareness of and use of the ACOG and Society for Maternal Fetal Medicine and Stillbirth Management Consensus document, its barriers to its utilization, and then certainly additional useful resources to find out what more may be needed. The focus groups brought together 16 fellows in a range of practices and at various career points, all of which were familiar with the document and had used it, as well as other resources to care for patients. And so the focus groups really focused on bringing to life a lot of the information that was laid out in the tables, figures, and boxes of that document, and that's kind of listed here. To really ensure that providers have practical recommendations and can actually put this information into practice. One specific area that we wanted to focus on was the support services surrounding bereavement care and the management of a subsequent pregnancy after stillbirth. And so that is what's listed here at the bottom. And so, taking what we learned from the focus group, a summary of those findings are kind of listed here, where participants really felt that the principles of bereavement care and tools and skills really needed to be reinforced among ACOG members. And so the findings were then discussed at a clinical consensus committee on obstetrics meeting in October of 2024. It was kind of resounding across the board at that time that guidance for supportive services was really lacking and also differed really among all the member institutions. And so people had shared that sometimes the things that they learned and were doing were really learned along the way, and there wasn't necessarily consistency. And so a combination of that discussion along with the findings from the focus group really led the team with the idea to develop a toolkit that would encompass comprehensive information on how to guide and have compassionate care and conversations regarding stillbirth. And so from that, one of the committee members, Dr. Brisner, really helped to develop a clinical summary table that served as a foundation for the development of the toolkit in terms of how it was divided by the stages of clinical evaluation. We thought the toolkit would be segmented in the same way and that we could provide guidance on how healthcare professionals can provide care throughout these various stages. And so when we're talking about kind of from here, the development of the toolkit, ACOG had a consulting partner, APCO, or the Association of Public Safety Communications Officials. And they helped to perform an overarching literature search and found that while there were some tools for patients, not really a ton existed in the realm for clinicians outside of A1, who certainly does have a catalog of amazing resources for obstetric professionals. ACOG then convened an advisory panel that consisted of myself and OBGYN, as well as advisors in obstetric and neonatal nursing, a bereavement doula, a lactation consultant, as well as the founder of Sisters in Loss, who is a woman who had her own experiences with multiple stillbirth and pregnancy losses, and that led her to found a maternal child health education company for Black women storytellers around pregnancy, infant loss, and infertility. Each member had the opportunity to review multiple drafts and provide their lens of experience and insight. The toolkit also then went through multiple internal reviews at ACOG with leadership, membership, graphic design, resource verification, and that occurred over the course of many months. This was also then done in collaboration with CDC, who they met with monthly to provide their own insight and feedback and review throughout the process. And so that leads us to the toolkit itself. And so as you can see, the table of contents is here to the left. But what you can see is that we kind of break up these conversations for each time point during care, from diagnosis to subsequent pregnancies. These conversations have sample scripts, such as the one here, as well as notes that can help guide the conversation and tailor care for each individual patient. There are various ways to access the resources, but this is the main page where the information is housed. Unfortunately, due to a lack of federal funding, we don't have plans to develop another version of the toolkit or to expand on this work, but the goal was, if funding had continued, was to see how this toolkit was being implemented across membership and, of course, other organizations, and certainly we're happy to share this with you today. I think the other thing to keep in mind, if Sheila were here, she would definitely say that ACOG is very happy to accept any feedback and personal experiences as people are starting to use the toolkit. And certainly in the case that original funding returns or funding is obtained from alternative sources, we certainly hope to expand on the work. I know that was a brief overview. I want to include kind of some of the resources that went into developing the toolkit, and then some other things that we have to support our members through these kind of clinical scenarios and discussions. Here's a list of people that were part of that team that I had mentioned earlier in developing the toolkit. And then I just want to thank everyone on behalf of Sheila and ACOG. Here's her email, so please don't hesitate to reach out with any questions, concerns, experiences as you use the toolkit, and certainly any feedback. And certainly myself and Dr. Gibbons are here to take any questions if you have them. I know that was pretty quick.
Thank you so much, Michael. Can you hear me okay?
It's a little quiet, but I'm
Right,
turning
okay.
you up. I think, there we go.
Okay, anyway, yeah, thank you so much. Are there questions from anybody about this brand new toolkit, which was just launched a couple of weeks ago? Yes, Brenda.
I'm on the ACOG website. Do you have to be a member to pull this up, or?
So, you guys, Michael and Karen, the question is whether you need to be a member of ACOG in order to access the toolkit. Somebody's on the website of ACOG right now and isn't able to access it.
Yeah, my understanding was that you did not have to be, but certainly I will look into that. But I would agree, this is something that we want to make widely available, and so even if you were not a member, we will make sure to get this out to people.
I can actually tell you that we've put a link to it on our Utah Stillbirth Center of Excellence resources page. I hope the link works.
Must be user error.
No. Other questions? Yes.
I work in the hospital in bereavement, so what is my role with this? Like, do the doctors already know about this and have access to this, or is this something that I can bring up to them?
So the question is from somebody who's working in bereavement care in the hospital, and what is her role in getting this, in using this toolkit? Would the doctors already know about it? What can you do? What can she do to get it out?
No, I certainly think because this is so new, this is not in everyone's hands quite yet. So, I mean, we would really appreciate your help in sharing this with all the clinicians that you work with, and certainly kind of take from it a lot of these key points, and certainly add the things that you know from your experience caring for these patients as well.
And I would add that, we're working with some clinicians across the country for the U.S. Pregnancy After Loss Network, and I know that some of those clinicians don't know about this toolkit yet. So I would guess that it's brand new, and it has not gotten out to many people who could make use of it yet.
Yeah, I would say, so I just double checked, you definitely don't have to be a member. It's a little hard to find. The way I've found it every time is if I Google like ACOG Stillbirth Toolkit, that brings you to a Compassionate Conversations webinar, caring for patients experiencing stillbirth, which is a conversation that I moderated between a couple folks who helped design the toolkit and some other folks as well. And then on the resources tab of that page, you can find this toolkit among with other things, but all of those are available to anyone.
Thanks.
That being said, I think that is good feedback that we can make sure gets back to them, that we can put this in a better, more centrally located place that isn't difficult to find, because we want everyone to have access to it.
For sure. Other questions? Okay, yes.
Do they have people that provide training for this already?
Great. So the question is whether ACOG has people who would provide training for this toolkit to providers.
Yeah, I think, and I don't want to speak on their behalf, Sheila would probably be able to answer this better, but my understanding is with kind of the removal of the funding source, it might be difficult. A lot of these teams are very small, but I think certainly something that we can look into, and certainly Karen and myself will certainly have particular interest in this area, and I think we can certainly collaborate with ACOG and hopefully bring these trainings out to institutions like some of the other trainings that occur through ACOG.
We're actually having a session later today, sort of a brainstorming session about actions that we can take to provide equitable bereavement care, and it strikes me that, this toolkit could play a role in that, and, what is the role that our community can play in getting this into the hands of folks who can maybe use it, as well as providing basic training, stepping into the breach, as it were. Yeah. Well, thank you very, very much, Michael and Karen, for being on. Really appreciate it. And also, I think very much we're grateful to know that ACOG is very interested in getting feedback from us all, from you all, as you try to implement the toolkit or use it. So that also could be something that our center could help with, is sort of funneling, helping to facilitate feedback going from providers to ACOG. I think.
Yeah, and thank you all for the work that you do. We really appreciate it. It's certainly a team effort when we're trying to tackle this large topic of stillbirth.
Thanks so much. Okay.